Next, we have Dr. Ananth talking to us about phakic IOL in low and.
Good morning. Thank you, AIOS, for including in this session. My topic is my clinical experience with Evolax enhanced monofocal visions. So, what is a monofocal plus or enhanced monovision? It's basically the optics of the monofocal lens, which give a distance as good as a monofocal, and it gives some kind of functional near vision or intermediate visions. That lens is called, and this is probably the next half decade that will be the lens of the choice. So the meeting of the visual needs, because every company, every IOL manufacturer is going towards that, because the need of the patient is become increasing over the light. Even the aged patient uses a lot of time over the laptop or driving and a phone or my mobile phone, and say need to have some kind of intermediate vision, so which the standard monofocals are unable to give. So if you go for the basics of the optics of the lens, there is apart from the diffractive one, there is three kind of lenses now. It's available: spheric, aspheric, and aberrated. And when the spherical aberration and aspheric is mixture, there is some kind of aberration which creates it's slightly aberrated optics, and which can able to give you some kind of elongated focus. So going to the basics of the lens, if we have the negative positive dysphotopsia, positive asphericity in the cornea, which is negated by the lens, is having a negative negative asphericity, which actually if we put a normal neutral or positive aspheric lens, the focus, that some rays will be in front of the retina. All rays will not able to focus in the retina. So if we go for the spherical and aspherical lens, the difference is every point of the spherical lens, if you consider the 20 diopter, every point is actually a 20 diopter. And the peripheral lens, once the incidence of ray is different, some rays from the periphery is actually focused in front of the retina. But what is aspheric? Aspheric actually, according to make a sharp focus, they may actually the change of the power of the periphery. If it is a 20 in the center, it is a 9.1 is the periphery. So it is able to, this is a beauty of the aspheric lens, and this is quite some time this is a standard practice. And these are the all lens, all EMB lens are actually mixing these sphericity and asphericity in the central part of the region, central part, and they are able to give some elongated focus. There is a long debate of which lens is called enhanced monovision, or which is called EDOF lens and extended depth of focus. So it's by my understanding, EDOF lenses, which lens is constantly give the intermediate vision, which we called EDOF lenses. So far we consider Symphony and the Attila, all are the diffractive design lenses are considered as the EDOF lenses so far. And the other part, which is the IHANS, and the other lenses which consider EMV lenses, enhanced monovision, that means it gives these are not the constant for give the intermediate vision. What Evolax is inducted, this is a EMB lens and the extended depth of focus, and Evolax is a hydrophobic platform, and it is an innovative design, and the center 4 millimeter, as I said, there is a opposite sign spherical aberration, that is a combination of the positive asphericity and the negative asphericity. They are able to create some kind of elongated focus, and some able to the patient can able to see at that range of the 60 centimeter. If you see that the focus, this is a single focus point, and that the Evolax is able to create a so design, and they gave a elongated single focus area and far to intermediate. And see, this is the beauty of the lens. And if you see the MTF curve of the lens, there is a distribution of the energy. There is a distribution. There is a high spike in the plus 1.5, so it gives a intermediate vision very well. And these lens are all the EMB lens. If the zone is very small, these lenses are basically a combination spherical asphericity and spherical and negative asphericity in the central part, so that the zone of the area is very important. As it has a 4.5 millimeter, it can able to give a good quality vision up to 3 millimeter pupil. And you see, if it is the pupil size is 4.5, the intermediate vision is dropped down. And the other the lens which is available in the market, they have even smaller zone. That's why that the pupil size of the patient of these other brand is very important. Even they're not able to give a very good vision, intermediate vision in the 3 millimeter zone. This, if you get the point spread function and everything, it is 99% fall within the spot of the 20 millimeter, 20 micron, and similarly the almost standard monofocal IOL. But there is some kind of diffraction from if you give the standard monofocal vision. But it will not keep any hamper your driving and other day-to-day activity. You can see the defocus curve. Sorry for the small slide. It is a very good compared to other vision. It is Evolax giving a 1.5 minus 1.5. It is a give almost logMAR table 0.2. So it can give a better intermediate vision and almost like any kind of EDOF lenses. As a monofocal IOL, Evolax designed to have good tolerance to unexpected residual refractive error also, as the zone are slightly bigger. You could compare to the monofocal to Evolax, you can see the optical chart, and you can see the refractive error. It almost similar to any kind of monofocal vision, monofocal IOL. And it is a hydrophobic material, made of hydrophobic material and non-glistening type. It don't have a glistening, which as other company has. So Evolax is almost monofocal plus IOL manufactured by SIFI, and hydrophobic preloaded version. It works a spherical aberration concept, as I said, and combination of positive asphericity and negative asphericity at the 4.5 millimeter. It's a bigger one, and it gives a excellent intermediate vision. So my total implantation, I have so far implanted 143 and bilateral implantation 27, and I am very happy. As company said, it is almost give as good as it's a really good. It's give a very good result at the 60 centimeter, and it needs only 1.5 most of the cases for the near 30 centimeter. And I mix and match. I implanted first eye 29 cases first eye hands, and second eye I implanted Evolax, and there is a lot of difference for the intermediate from eye hands to Evolax. Evolax is a much better way to give the intermediate vision. And if you consider EDOF, it is actually, if Evolax is very close to EDOF lenses. Thank you so much. Thank you for your questions here.
Thank you, Arup. We know the optics are quite different, the VVT, the eye hands, the Evolax, etc. Very shortly, how does the performance of this lens differ from the others? I'm not talking about
these all the lenses, starting from eye hands, Evolax, and all the EMB lenses, not 100% consistent. There's sometimes you need you need the patient need 1.5 for near. Sometimes you need 1.75. Sometimes need 2. But compared to other diffractive video of IOLs like Symphony, it's a constantly give intermediate vision. So far, if you consider the three lenses, IHANS, VVT, and I think VVT and Evolux give a very close, very close. But yes, Evolux is price is much less than the VVT. And IHANS, yes, it's a path-breaking technology. It came 2 years back. We already experienced the IHANS. We can understand that the IHANS is a very good lens, but it is not consistent.